If we can't take time for ourselves and find ways to create a healthy physical and emotional lifestyle, how are we going to care for our patients? Welcome back to my channel. I am Chrissy Mary Taylor for those of you who are new, and on this channel I post content that's mostly related to the healthcare field, specifically medical assisting, nursing, and health information management. So I currently work as a medical assistant from home. I am a nursing student and I'm also a registered health information technician. Just a little bit of background for my newcomers. In today's video, I'm going to be talking about some of the things that I was not prepared for working as a medical assistant and that I learned mostly on the job. And guys, initially I did decide to make this video specifically for certified medical assistants, or if you're looking to become a medical assistant. But after thinking about it and kind of really reviewing and thinking about this video, it really can be intended for anybody that's getting into the healthcare field, that's working directly with patients. So whether you're becoming a nurse's aide, a nurse, a doctor, a physician assistant, a medical assistant, a patient care tag, anything that has to do with direct patient care, you can probably take some helpful information from this video. So I did do a similar video a while back. It was titled Some of the Things That I Did Not Know Before Going into the Medical Assistant Program. This video is geared towards working in the actual field. But if you guys do want to check that video out, of course I will link it as well down in the description box below. So if you are currently in school for, like I said, anything related into the healthcare program, schooling itself is a great way to build a foundation in the healthcare industry, and you do learn a lot. However, there are some things that you specifically learn while working on the job that school does not prepare you for, or sometimes they'll touch a little bit on it, but you really don't get the full-on experience until you're out there working in the field. So like I said before previously, currently I do work from home, but I've also had some on-site experience or face-to-face experience as well. So hopefully this video gives you some type of insight on what to expect when you actually go out into the field. So if this is a video that you think you could be interested in, let's go ahead and jump right into the video. So there was a lot of things I learned after I finished my CMA program and when I started working in the healthcare field. Aside from the things that I was already prepared for, like dealing with patient records or electronic records or administrating injections, and a lot of the more hands-on work, first thing I actually had to realize is you won't know everything, and that's perfectly fine. So because I was brand new to the healthcare field in general, I literally knew nothing. And mind you guys, my program was not that long. I actually did learn a small percentage of what medical assistants who actually do the full term program, I actually learned a small percentage of that. Usually a regular CMA program is about 2 years in length. I completed my MA program after about 5 months. I actually remembered my first few weeks working as a medical assistant, and for a brief moment it literally seemed like the little knowledge that I did have completely flew out the window once I actually started working. I felt like I was incompetent, like this wasn't the right career choice for me, and I kept thinking there is no way I'm cut out to be in this field if I can't even do the job. One of the things I can promise you is when you go into the healthcare field, you won't ever fully know everything. And that is strictly because everything in the healthcare field is rapidly changing. Everything is changing. And this means that you are constantly learning. I had to learn that in the healthcare field, everyone feels incompetent at one point or another. That's simply because nothing stays the same. Like technology doesn't stay the same, like computer systems doesn't stay the same, protocols change, practices change, healthcare changing always, constantly, it evolves, hospitals, all of that stuff changes. So being a new medical assistant or new anything in the healthcare field, regardless of how many years you've been in school or how many years you've been doing your clinical, when you first step foot out on those floors, you will feel like you will know nothing. You may even feel like, is this the right career for me? You may even second guess your career choice, and that is normal. Just because your program is complete does not mean you stop learning or the learning stops there. Take advantage of every learning and training opportunity as you can. You actually learn a lot more when you're out there working in the field versus when you're doing clinicals or in a classroom setting. And make sure you are taking your time during the training process. If you're not understanding something, let your trainer or your preceptor know. I don't care, guys, if they have to train you 100 times. You want to make sure that you perform your job to the best of your abilities so that you know confidently you know what you are doing. I remember when I first started working, being terrified to ask someone for clarification. Like, if I didn't know how to do something, I was terrified to ask. I was afraid to ask my colleagues or team leaders for help because I didn't want to be looked at like I didn't know what I was doing, or I didn't want to be looked at as incompetent, or I was worried that someone might be upset with me because I wasn't grasping onto the concept as quickly as they would have liked me to. Until one day I expressed this concern with one of my team leaders who was a 20-year experienced nurse, and she told me, never be afraid to ask anyone question, especially if you're unsure about something. The reason for this is because at the end of the day, you are responsible for giving your patients the best and optimal care as possible. And it's better to ask someone for help or get a more experienced healthcare professional's input on something if you're unsure. Because if you guesstimate on something that you have little knowledge in, you could possibly be harming your patients, and that falls on you. And this goes for anyone, whether you're a new grad or if you're more experienced in the healthcare field. It's always okay to ask someone, even if you're unsure about something or you don't know something. Even more experienced healthcare professionals, people with 20+ years, do not know everything. And like I said, it's because the medical field is always changing. It's always rapidly changing. So it's okay if you don't know everything. And if you are new to the field, try not to feel incompetent with what you are doing. You are obviously hired for a reason. And it's okay if you're not perfect at your job just yet. In fact, no one's perfect, but it's okay if you're not grasping onto the concept just yet. Remember, some of the more experienced professionals that you currently work with, they started out as newbies too. Once you've had the proper training and you feel confidently enough, you'll be more up to speed and acclimated with everything. But it is a process, so remember, you don't have to rush it. It'll come with time. The more familiar you become with it, it'll be like second nature. Another thing I had to learn was confidence. Now, just because you're not familiar with everything and you don't know everything, it doesn't mean you have to let your patients know. Now I know what you're thinking. How do I have confidence, Chrissy, if I don't know what I'm doing? And if you're like me, you second guess yourself a lot, and I mean a lot. The idea of having real patients to deal with and real paperwork, it can get very overwhelming, and it can feel completely different from the pressure you felt when you were in school dealing with classmates as your practice patients. It is a completely different ballgame when you get out there into the real work world. One way to build on your confidence, and of course we've all heard this before, is to simply fake it until you make it. Obviously, guys, we work in healthcare, so that obviously doesn't entail administering treatment or diagnosing a patient if you generally don't know what you are doing. But when I say fake it until you make it, basically present yourself like you've been in the field for years. Carry yourself like you have been doing this for years. Speak with authority and ask questions if you don't understand something. And I will keep taking it back to that. Yes, ask questions. But believe it or not, guys, that also alludes to confidence. Never be afraid to ask questions. I don't care if you think it's a stupid question. By asking questions and double checking yourself, you'll feel more confident. You'll be able to incorporate helpful information on how to properly give patient care to your patients. This way you'll be avoiding mistakes and you won't be potentially harming your patient, and no one wants that. Again, I had to learn this my very first job as an MA. One way to build on confidence is to find someone who has a lot of experience and have them mentor you. Watch what they do and how they perform their job duties. Ask them questions, take notes, build your knowledge. Ask them to give you feedback when you perform your daily tasks. And your mentor doesn't have to be like a team leader or someone that your manager assigned you to. Find someone that you feel comfortable with. This will help build your confidence so you can properly and confidently do your job. Another thing I had to learn was how to deal with job-related emotions. No amount of clinical or classroom experience could prepare you for the amount of emotional toll you will feel in the healthcare field. I guarantee it. I remember one situation where we had a mom of 3 get diagnosed with a terminal disease. And that was actually my first experience dealing with a sad situation in healthcare. And it just really opened my eyes on how emotional the healthcare field can actually be. When you are caring for patients, especially when they don't feel their best, it's like you go on these emotional roller coaster experiences with them. Sometimes situations are not always minor problems. You are constantly dealing with people who don't always feel well, which means their moods are not always the best. And this is why they come to us as healthcare professionals in the first place, to care for them. So developing effective stress management strategies in the healthcare field early on is imperative. Mental health conditions can threaten the well-being of a healthcare professional and ultimately their patients. Working in healthcare, I also learned there's a high likelihood you will develop negative emotions, and that includes fear, anxiety, and frustration. And more often, unfortunately, sometimes you must conceal these emotions to maintain some type of professionalism. So being in this field can definitely be hard on your emotions. So while you will often feel the highs of successfully treating patients, it's not always positivity all the time. There are actually lows where you see a patient's health decline and deteriorate despite your best efforts for caring for them and doing all of what you can do. You may even lose patients that you build warm relationships with, and this can take a heavy toll on your work performance and sometimes even your home life. And oftentimes healthcare professionals take a lot of that stress home to their families and end up having burnout. Which brings me to my next point. One of the things I had to learn in being in this field is the importance of self-care. People in this field ultimately choose this field because they enjoy caring for people. However, sometimes the physical and mental health of a caregiver, it does kind of get overlooked sometimes. Now, obviously, making sure you are physically healthy is important, because if you have a person who's sick or injured or otherwise just not feeling well, you won't be able to help them if you're not feeling physically your best. I know this sounds cliche, guys, but it is very important to maintain your basic self-care physical lifestyle. This includes, of course, proper diet and exercising, of course, having a good sleep routine, spend time outside, and just make time for yourself. It's cliche, but it's important to know this. It is important that you make time for yourself and just take those moments to breathe and relax. You must also make sure that you are mentally healthy. Taking care of your mental health is important if you are wanting to go into the medical field. Focus attention away from negative thought patterns. Listen to affirmations. Find anything that promotes happiness and joy, like spending time with friends and family outside of your work hours. And definitely take advantage of counselors and therapists. Like, if you need to, find therapy, get counseling if you need to. Mental health is important, and it is a must if you're going into the healthcare field. Also, learn to say no sometimes. Saying yes to everything predisposes you to burnouts. It's perfectly fine to say no sometimes to protect your peace. Medical professionals need to have a work routine to effectively schedule time for self-care. If we can't find ways to create healthy physical and emotional lifestyles, then we are not able to care for our patients. Working in this field, you will never really know what to expect. Even when you're out there during your clinical rotations, during your program, you just will never know what to expect until you're out there on the job getting the experience. And the biggest and most valuable lesson that being a medical assistant has taught me is that I want a career in the medical field. Being able to see the impact that you have on someone and the chance you get to be able to help improve someone's quality of life, it's rewarding. And this is something that you will never really know, or never will get the full experience unless you are working in the medical field. School will give you an idea, but like I said, like it's no comparison. Okay guys, so I hope this video has helped you give you an idea on what to expect when you actually do go into the field. If you like this video, make sure of course you share it, leave me comments, like it, of course subscribe. Feel free to share your own experiences in the comment section below. Also let me know what healthcare profession you are in or that you may be interested in. And as always, I will see you guys in the next video. Bye.